Hello, welcome back to Care Zone. My name is Grace, and today we'll be discussing a very popular health issue: piles or hemorrhoids. They are popularly called jedi in the southwestern part of Nigeria. You can help me in the comments to mention or tell me what it is called in your own language. So today we'll be answering a few questions. Are piles caused by sugar, excessive sugar intake? What are they? How are they managed? We'll be looking at these things in a bit. So please sit back, and if you have not subscribed to this channel, please do, because I share educative content that is meant to help you enjoy the best health and good quality of life. So sit back and let's dive right into this popular issue: piles, hemorrhoids, jedi, as it is popularly called. Piles are red, inflamed blood vessels around the anus and rectum, and when they are inside, they are called internal piles or internal hemorrhoids. But when they are outside, around the skin of the anus or under the skin of the anus, they are called external hemorrhoids. But the question is, what causes piles? Is it excessive sugar intake or some other things? Well, piles are caused by anything that causes trauma or pressure on the rectal or anal area. Piles may be caused by pregnancy because of the weight of the baby that pushes downwards on that area. It can also be caused by lifting heavy weights, poor diet, a diet that is lacking in fiber and nutrients can strip the body of water needed to make the stool or the bowels move freely. Another possible cause may be the genetic, the anatomy of a person's rectal or anal area. It could also be caused by aging. A person, especially those from 50 and above, excessive straining during bowel movements, or sitting back after passing the bowels or after moving the bowels, sitting back there, maybe just sitting down idly or pressing phone or doing something else, just sitting on the toilet seat for a prolonged period can as well apply pressure to the anal or rectal area, and this could predispose a person to piles and hemorrhoids over time. Anal sex as well may cause hemorrhoids. So there are so many causes, but the question is, what are the symptoms? What are the things a person who has piles would feel? There will be itching, inflammation, irritation, pain. Sometimes there could be bleeding or leakage of poo from the anus. Sometimes there may be prolapse, and then the pile begins to shoot out or drop down from the anus. This can be pushed in by the person, or it just goes in by itself. Sometimes they may be so bad that they will require a surgery, depending on the stage of the pile. Now, for the management of piles, you can walk into the nearby pharmacy and get creams and ointments that may contain anesthetics, may contain anti-inflammatory steroids that help to manage, even pain relievers. Other ways that it can be managed is by using a seat bath at home, a warm seat bath, just sitting in warm water. You can as well use paracetamol, but if it is bleeding, you may avoid using ibuprofen because it can intensify the bleeding. The best way to manage, or the best treatment for piles and hemorrhoids, is prevention. That is the best treatment for any disease at all. So what are the ways we can prevent it from happening at all? We have mentioned things that cause it. So undoing or preventing or avoiding those things can help us prevent hemorrhoids. I'm talking about not sitting too long on the toilet seat. Once you're done there, the best thing to do is to get up and leave. We also want to avoid bearing down or pushing every time we want to go to the toilet. So what about excessive intake of sugar? Well, let's put it this way. Excessive intake of sugar can cause problems that lead to piles. For example, sugar is empty, it is empty calories. It has no fiber that help to keep the digestive system moving. So what happens is that it strips the system of the needed water or fluid, which keeps it moving. And so it's possible to come down with constipation due to excessive intake of sugar. And this in turn could lead to piles, because it will mean having to strain very hard in order to pass or make bowel movements. Another thing about our diet is that if a diet is lacking in fiber, vegetables, raw veggies, then it is possible we come down with piles. We also want to make sure that we take lots of water. If we take too much of refined sugar, bread, coffee, fried foods, chips, salty foods, these things strip the system, the digestive system, of the needed water. And so the poo becomes harder. And when we want to go, we notice we need to bear down or strain. And this pressure that is being applied to the rectum or the anus can cause piles or hemorrhoids. Other things we need to do is avoid anal sex and also avoid holding poo. If you feel the urge, it's good to just go. And once you're through, please get up, because sitting back there can continue to exert pressure on that area, and over time it can predispose the person to piles. So we want to use these preventive measures. And also it is important to exercise, get moving. If you have a job or a lifestyle that makes you sit all the time, it may be necessary to get up periodically and move around. Exercise regularly, make a routine of exercise, move the body. It helps also to move every part of the body and all the other systems of the body, including the digestive system. So these are ways we can prevent piles. So if a person has piles or hemorrhoids and has done all of these diet changes, lifestyle changes, taking medication from the nearby pharmacy, using sit baths, and managing the pain with pain relief medications at home, and there is no improvement, do not do this for more than a week or two. If there's no improvement, please visit your doctor. If you liked this video, please subscribe to my YouTube channel for more. My name is Grace, and this is Care Zone. Bye.